Welcome to JAT Chat, presented by the Journal of Athletic Training, the official journal of the National Athletic Trainers Association. I'm Dr. Kara Radzak, an associate professor at the School of Integrated Health Sciences at the University of Nevada, Las Vegas, and your host for today. Today, it's my pleasure to be joined by Drs. Morgan Eckenrod and Melissa Kossman, the authors of the professional practice document entitled Working with and Through Athletic Trainers to Meet Student Athletes' Mental Performance and Mental Health Needs, which was recently published in the Journal of Athletic Training. Dr. Morgan Eckenrod is a certified mental performance consultant and assistant professor in the School of Kinesiology and Nutrition at the University of Southern Mississippi. Dr. Melissa Kossman is an assistant professor of athletic training and director of the School of Health Professions at the University of Southern Mississippi. Morgan and Melissa, thank you for taking your time to speak with me today.
Thanks for having us.
Thank you for having us.
So can you share a little bit of the background of what inspired you to kind of create this across disciplines collaboration and write this article?
Yeah. So Melissa and I have worked pretty closely in our disciplines since we've arrived at Southern Miss. We've both been there. This is our 6th year. So we cross over in a lot of ways, but this paper was inspired because of Melissa having an athletic training background and mine being in mental performance consulting. And so we decided to collaborate and write this article because there's really not a lot out there that talks about this multidisciplinary approach to meeting student athlete needs. And so we thought it would be a great crossover, one, because as athletic trainers, which I know Melissa can touch more on, there's the competencies in mental performance and mental health in your requirements. And so how, from my perspective, being a mental performance consultant, how can we better bridge the gaps of collaborating together so that we can take some of that load that comes onto the athletic trainer's plate and maybe having to navigate some of those mental performance type challenges, and how we can provide support in bridging that gap.
Yeah, we, as athletic trainers, we're kind of like the hub of the wheel, right? The sports medicine metaphorical wheel. So we've got all these spokes that come off, and mental health is certainly one of them. But it's very easy for us to feel like we have to have all the answers to everything, and we certainly do not, nor is that necessarily a good thing for our patients. And so being able to lean on the providers who specialize in these things, yes, we can identify it, we can triage it, all of that, but really they are the ones that help us get to the end goal of improving athletes' health and well-being in that avenue. So we thought it was really important to bring light to that because it's something that not a lot of schools have access to. And so how can we help advocate for that to also make athletic trainers' lives easier selfishly too?
That makes a lot of sense. Now, Morgan, can you outline some differences between the professional focus is on mental health versus mental performance?
Yeah, so I can start in the realm of mental health in mental health. And so those that are experiencing or working in the mental health sector have some sort of master's and or doctoral training in counseling, clinical psychology, social work. There's a slew of pathways that you can go to working in this realm. The focus of a person delivering mental health services is dealing with pathological mental health. So we're talking potentially generalized anxiety disorder, diagnosable clinical depression. And so we're working in sector that's more around those pathological challenges. As related to in connection to mental performance is a little different. Mental performance services is focused more on the sports psychology, kinesiology, and psychology. That's how we look at our training. And our focus is helping athletes or performers change the way they think. And so we're looking at how can we enhance focus or improve confidence and so forth through the implementation of different strategies. So we're focused on the performance sector and how we can move from point A to point B to elevate performance, whereas mental health, we're dealing with more of a pathological concern in those sectors.
And one of the things that you guys talk about in this article is that there's oftentimes an overlooked distinction or delineation of these two pathways in collegiate athletes. What do you think why is this being overlooked? What are some barriers?
So I can start. I know that Melissa will chime in on this. So sports psychology sometimes is used as an umbrella term, and then everybody's funneled in underneath. So there often is confusion or just overlap in how we view it because of how the umbrella term is utilized. But how this potentially gets overlooked is that in collegiate athletics, some of the barriers are financial resourcing to be able to hire professionals. And so that's the biggest challenge we see is that a Division I institution that has an abundance of financial resources is able to potentially hire more professionals, whether they're more mental performance consultants or mental health providers, to meet various needs within the athletic department, as compared to maybe a smaller institution that maybe only has the availability for one resource. And so, one, I think it comes down to the financial availability. Two, it's the education around the differentiation between services. Like I said, sometimes it gets coupled under sports psychology and then everything gets mushed together. However, there's in times a lot of lack of understanding of how mental performance is its own entity and mental health is in its own sector. However, those providers can work with and through and in connection to one another to best support student athletes that could be having a mental health concern or dealing with a performance related challenge. The financial barriers seem to be some of the biggest factors that influence this.
Yeah. I mean, they certainly have a lot of cross training, which I think causes or at least contributes to a lot of the confusion between the providers, but they have very different competencies, right? It's like ATs and PTs. We have very different competencies, although we can work seamlessly together. And so I think for a lot of athletic departments, because of the fact that they're viewed as this kind of umbrella terminology, they don't necessarily understand the value that each independent provider brings to the table, because they're just to a point, oh, we checked the box, we have a mental health provider, our student athletes have access to that, which doesn't always mean that they capitalize on those nuances.
Melissa, what are some practical ways athletic trainers can advocate for a more interdisciplinary approach to psychological care in athletes?
Yeah, I think that's a super hard question,
Yes.
just from the standpoint that I feel like we advocate all the time and it very rarely actually gets implemented. But knowing our background and knowing the fact that we are known as the patient advocate, I think we would be selling ourselves short from a workload perspective, but also ultimately selling the athletes short by not having access to what they need. So I think one of the things that's easier to advocate for is referral channels that are appropriate and thorough and solid. It's probably a lot easier to refer for general mental health disorders. There's a lot more providers available for that in every location. And that's something that tends to kind of fall in line with typical referral patterns. So I think that's something that's a little bit more comfortable for people. But in order to do that, you have to have those networks established and in place before you need them. And so I think advocating for ways that you can create partnerships and things like that with some of these resources, especially if you only have one provider on your campus, whether that's high school or college, then at least it'll lessen that workload so they can truly specialize in what they were brought there for.
Now, going back this idea of financial constraints being a big barrier, like what are some creative solutions that institutions might want to explore to address this?
Well, I would say some of the creative solutions can be, if you only have one provider, is maybe utilizing other mechanisms within the university system, if we're talking about university system. So for instance, if you're working at an institution that has maybe a sports psychology master's and or PhD program, there's an opportunity to form partnerships between athletics and the educational institution to not only be able to meet needs related to student athlete needs in the athletic department, but then also providing graduate students opportunities, supervised experiences to deliver services to supporting athletic departments. The same could be said even for other entities on campus, counseling programs, clinical psychology, social work, and so forth, finding ways to partner to be able to provide students opportunities to deliver services and then also helping to meet those needs within the athletic department without actually having to hire potentially somebody if the financial means are not available.
I would agree. I think the ability to lean on those internships and practicums and those student experiences, because honestly, they're trying to get A's. Like they work harder than anybody else, it feels like sometimes. And they're always supervised. And so that's good too. And then those referral patterns are two kind of creative ways that you can lean on low impact, low kind of commitment, high impact resources. So those are both ways that can creatively be used to kind of navigate financial constraints.
So, for the ATs listening, what are some ways that athletic trainers can more effectively identify and support student athletes who might be struggling with either mental health or performance related issues?
Yeah, I'm not so sure if it's necessarily an identification issue or a lack of kind of the network and understanding of where to go once it's identified. I feel like as athletic trainers, like I've already mentioned, we're very innately in tune to how our athletes are doing. And it's very easy for us to pick up on something's not right today. Like you're not quite yourself. But with that said, it could be that they failed a test and they're just truly having a bad day, and that happens. Or it could be something more serious. And knowing how to navigate that is, I think, where it gets sticky for athletic trainers. That it almost seems to be we try to treat it so differently than all of our other types of injuries and illnesses we navigate, right? We have these networks with team physicians that will call up, we'll send a text message to, we'll say, "Hey, can you talk to this person about this injury? I'm not so sure." Right? We can do those same things with these other providers if we have that network established. That I think almost kind of taking away the novelty of it would be really important because ultimately at the end of the day, the athletic trainer's job is still the same, right? To identify the issue, get them the appropriate help that they need, whether that's us or somebody else. And so I don't necessarily think we need to reinvent the wheel there. It's just I think we need to approach it in the way that we know how to approach injuries and illnesses in general.
I mean, I think too, to flip this on its head a little bit, I think that a lot is put on the athletic trainer. And I think there's work that can be done on the mental performance, mental health side from the provider side, where we are also establishing really strong networks with those not only athletic trainers but other support staff within the athletic department to show that we are there and we're here to be a resource and a support whenever that time does come. And so a lot of emphasis is put on the athletic trainer. I'm not an athletic trainer, so I don't know what it's like, but I can only imagine the workload that is present. And so if we as providers, and again, me solely being a mental performance provider, but advocating and calling on those in both mental performance, mental health can establish strong relationships and be a resource, then that could also just help in supporting the athletic trainer and what they're doing with the student athletes.
And Morgan, in your experience, what have been some ways that this relationship has gone really well? So, say there's somebody out there who's never actually been able to work with a mental performance consultant as an athletic trainer, they haven't had that relationship. How can somebody start one of those relationships with a provider for their athletes, and how can they make sure that that's a successful collaboration?
That's a great question. I think, from that perspective, it's just finding time to build relationships, whether it's formally or informally. I mean, working in an athletic department, and as somebody that's not worked fully in an athletic department, I can only imagine the intricacies and the workload that goes into everybody that's involved. And so carving out time, whether it's formally when we're at, multidisciplinary meetings with as an athletic department, to connect outside of it, to develop relationships, not just related to the work that's being done behind closed doors within the department, but then also finding out, what this person is about, learning about them as who they are, and developing personal relationships as well so we can understand them as a whole person. And then there's also those informal relationships. I mean, just picking up the phone in your office and calling down to the training room, "Hey, how are you? How's everything going?" Or carving out time to go to lunch within the athletic department facilities, things of that nature. It's just spending time being intentional and developing those relationships, which it doesn't have to be anything overarching, but just having that human to human connection that could then lead to then just developing a strong relationship that could be utilized purposefully when working to support student athletes.
For sure. I mean, I think with one of the biggest problems that could happen with this is athletic departments see the benefit and hire these people, but then they're not used. Right.
Right.
And so being able to create those partnerships to where they are just visibly present and available and willing to help will go a long way in terms of actually having utilization of resources, which then in turn shows the athletic department that it was a good hire and a good move and that they should do more of it. And there's also this like keeping up with the Joneses, right? Within athletic departments that if one school in your conference hires a mental performance consultant and they start to do really well, right? That's going to permeate the rest of the conference. And so how can we kind of leverage those things to create these partnerships, but not just create them, create them for ultimately the benefit of the athletes?
So, what are some good resources for athletic trainers to learn more about how to potentially start accessing mental performance consultants with their athletes? How does somebody identify one of these individuals?
Well, within the Association for Applied Sports Psychology, which is the association that the credential, the Certified Mental Performance Consultant credential, does run through, we have a registry on the Association for Applied Sports Psychology website where anybody really, can go on and type in their state or geographic location, and it'll populate to show providers that hold the Certified Mental Performance Consultant credential in that geographic location. So that might be a nice place to start to see who is available in that sector of whatever part of the country or world that you are in. The other piece is going to the educational piece. I know on the Association for Applied Sports Psychology website, there's information about what the services are, what mental performance services are. So that might be a nice place to go to then gather additional information, including resources and the registry for providers that are available. I know that even with mental health resources, the APA has their website as well that they could access mental health resources. But the registry would be a nice place to start to see who exactly is in that sector and where you're positioned.
And what are some options if you are maybe in a rural area? Can those that are potentially in a rural area or in a deficit of still get access to this type of care for their patients?
I would say from a mental performance perspective, yes. I know, since COVID taught us that we could do things digitally, which again has its pros and cons, but there's options there for service delivery if it's not necessarily in person. There's also the option that if you connect with a consultant of finding a way for that individual to come in potentially on a contracted basis into your network to meet your needs. And so it could go twofold. There could be the virtual potential, and then also finding somebody that fits what you're looking for that you could potentially have come in on a basis that meets the needs of which you're wanting for your program.
Great, thank you. If an athletic trainer listening to this podcast wants to take the first steps for advocating for better mental performance resources, how would you recommend them starting that conversation with their athletic department or their administration?
I think number one is knowledge is power, right? Like they have to understand the differences between the two types of professions to be able to successfully advocate to their athletic department of why they need those two types of resources. The other thing that you have to consider is the mental performance consultants are much more specific to sport related needs, whereas a general mental health provider may or may not be. And within the mental health research, we see a lot of athletes hesitant to utilize those services because of issues like confidentiality, or they think that their coach has a certain mindset towards mental health. So just because it exists in their world doesn't mean that it's effective. And so really getting that knowledge yourself of who the players are, why they matter, why they're important, and why they would ultimately benefit the athletes, I think is probably your number one step towards approaching the athletic department, because chances are they're not going to understand those nuances themselves. They're thinking of the check boxes, right? We have a mental health provider, the end, we're done, right? Until it's actually blatantly in their face that like that's not sufficient.
And then there's also, having data, if getting access to data of how the services could be beneficial or how the services are utilized. If we can quantify something, it shows us it could help in demonstrating why it's important. And then also anecdotal reports and stories go a really long way of hearing people's positive experiences with service and how if these people or this person or this athletic department had a positive experience with, mental performance services, how can, that could be something that our athletic department could benefit from. And so having also that quantifiable data and then those stories and those anecdotal reports can also potentially help. But again, I think it goes back to like what Melissa said, having the understanding of the differentiation between the two is really where it starts. And then the other pieces are just mechanisms to help in driving that forward.
Can you give some examples of data points that somebody could start collecting to build this case?
Yes, I would say this. I mean, the number of, clientele. I mean, obviously this is a confidential work that we do on both sides of the coin, mental performance and mental health, but quantifying the number of student athletes they're seeing a semester, how many teams they've seen. You could be, and again, I would recommend that if somebody is delivering mental performance services, that they're not the ones necessarily distributing, survey resources or opportunities, but asking the athletes how they've benefited from services or what improvements could be made. And so doing things in that manner. And then again, there's other opportunities out there to hear people's stories. I mean, I think, this coming off of an Olympic year, we hear about the stories of people utilizing services. And I think that we're starting to see and hear more about not only professional and Olympic level athletes, but the collegiate and even high school athletes utilizing services. And so, but those data points would be a great place to start. And I know that there's institutions like, for instance, Cal Berkeley, they gave a presentation recently. They've been collecting data on their athletic department and service delivery related to mental performance services over the last couple of years. And it's astonishing to see how much data is out there that could then help in propelling a case of why this resource is needed.
Mm-hmm. Any final thoughts on the future of mental performance and mental health services in collegiate athletics that you want to kind of bring up?
I think it's so new that it's really an exciting kind of partnership to create and establish. And for that whole mindset of keeping up with the Joneses, it's the front end, right? And so there's a lot of potential to kind of set new standards and establish new partnerships and create really impactful and meaningful collaborations for the betterment of the student athletes. And to Morgan's point about data, just the utilization alone shows how important these services are, right? If 70% are using these services, I guarantee you they're not just stopping by their offices to say hi, right? That's great, but that's not going to count as a data point. So that in and of itself just shows how important this partnership is to be able to kind of move the needle in the positive direction.
And the pressures now are higher than they've ever been in athletics globally. I mean, I would even say down to the youth sport level. I mean, we're seeing a change in landscape here, even from the times when we were collegiate, when I was a collegiate athlete before. And so the pressure is going up. We've now got, not only the standard pressures of being a student, having to perform whatever level you are at in your athletic endeavors. Now you've got this NIL piece and this financial piece that's now coming into play, in addition to social media and the media pressures just globally that come into being an athlete across varying levels. And so I think the pressures have just increased exponentially. And now from what was used to just be focusing on being a student and an athlete is now just gotten very complex. And so if we can have resources in place to support these athletes, whether it's on the performance side or the mental health side, we are going to, one, be able to better support them in those moments, and two, help them in developing life skills that can translate beyond being on the field or the court.
And I think you guys bring up in the paper a good point about how starting now to prevent it from becoming a mental health issue, like start with the performance, and you preemptively get ahead of a problem.
I mean, I do the same thing, right? If I have a really stressful day, eventually it'll spiral and build and build. And then it can turn into burnout and all of these other things that we experience as healthcare providers too. The same thing can happen with them, that if they just have a bad game and then they can't get out of their own head, it's that whole concept of missing a shot and never being able to sink one after that, right? That if they can't get out of their own head, eventually that'll build up and build up and build up and can potentially lead to anxiety or fear or whatever it may be that's at a more clinical level.
And if we could be proactive in, athletic trainers being able to see it and then moving through the referral chains to the right professional, if this is something that's not just a one-time thing, then we can be proactive and help them in getting back to or shifting to a positive mindset that can help them not only in sport, but beyond.
Dr. Eckenrod and Dr. Kossman, again, thank you so much for taking your time to join me today. And I really think you provide a lot of great information, not only here, but also in the manuscript that athletic trainers are really going to enjoy with this quick read. And just a reminder to everyone that this is open access. This manuscript is open access, as is all of the Journal of Athletic Training's work. Again, thank y'all so much for joining me today.
Thanks for having us.
Thank you.